All right. Hi, Austin. My name is Stone Manzek. I'm a nurse practitioner student at Youngstown State University. Today we'll be conducting an abdomen and blood vessel assessment. This should take like 10 to 15 minutes. What I'll be doing is just looking over your abdomen, listening, feeling for anything, then doing some inspection of your legs, your arms, your shoulders, all that stuff.
Sounds good.
Have any questions before we begin?
No.
Awesome. So before we start this video, we did some basic assessment at the beginning, took his vital signs, height and weight. The patient's height was 5 feet 10 inches or 177.8 centimeters. The patient's weight was 178 pounds or 80.7 kilograms. His vital signs were blood pressure of 126/74. Heart rate was 68. Pulse ox was 100% on room air. His temperature orally was 98.4. And his respiratory rate is 16 breaths per minute. All right, Austin, how are you feeling today?
Good.
Are you having any pain?
No.
No pain anywhere, everything's clean slate?
Yep.
Good.
Everything's fine.
Any health concerns right now you wish to share with me?
No.
Oh, good. So he seems like he's in good health, no obvious concerns. So we're going to begin his abdominal assessment. Ask him a few questions. So before we begin, do you have any abdominal pain?
No.
Any bloating?
Nope.
Have you been experiencing any nausea or vomiting lately?
No.
Good. Have you had any diarrhea or loose stools?
No.
Any new or unexplained weight loss in the last couple months?
Nope.
Good. Appetite been okay? Eating well?
Yeah.
Good. So awesome. So no concerns regarding your abdomen, nothing you pointed out to me. So now I'm going to begin by inspecting his abdomen. So I'm going to have you lay flat
Right.
on our table. All right, I'm going to pull your shirt up, okay?
Yep.
So upon general inspection, I'm looking for size and shape, and symmetry. Everything is symmetrical, pertinent size. I don't see any protrusions anywhere. Looking at his right lower, right upper, left lower. No signs of any bulges or masses. No striae. No cuts, bruises, hematomas, any scarring. Good. Awesome. So everything looks good there. Now I'm going to have you sit up a little bit, kind of like you're doing a crunch, checking for any abdominal masses, hernias, any bulges, any muscle lengthening or separation. Good. Everything looks good. You can lay flat. All right. So now, to start the exam, I'm going to auscultate on the quadrants of his abdomen using the diaphragm of my stethoscope. Checking for peristalsis. All right. And then I'm going to check his liver and his spleen for any vascular sounds. Good. So no friction rubs noted on this new spleener's liver, so that's normal. Active bowel sounds, not hyperactive, not hypoactive. Listening to peristalsis, everything was there. Between 5 to 30 gurgles in a minute, which is normal. It's irregular, it's not going at a regular, consistent pace. So everything looks good there. Now I'm going to use the bell of my stethoscope and listen for any bruits at his aorta, his iliac, his femoral, his renal arteries, okay?
Yep.
If you can hold your breath for me if possible. Abdominal aorta, renal arteries, iliac arteries, and femoral. Checking for any bruits. Good, thank you. No bruise were noted at any of the major landmarks, arteries of his stomach. Everything looks good. Wasn't able to hear any bruise over any of these vessels, which is a good sign. So now while you're laying down, I'm going to percuss his abdomen. Should hear tympanic sounds. Dullness here over the liver. So after percussion, everything sounds good. tympanic. There was some dullness up here by his liver, but that's within normal limits. That's what we should find once we reach that lower liver border. So everything looks good percussion-wise. Okay, now I'm going to be measuring his liver borders that we talked about earlier. I'm going to percuss up his abdomen on the right side, right below his liver border. I'm going to notice the change in sound once I reach the lower level of his liver. All right. So that's marked. I'm going to do the same thing with his upper chest, going over the resonant sounds of his lung field. And once I get to the top of the liver border, I'm going to mark that spot too and measure the difference in between. All right, those two spots are marked. I'm going to measure in centimeters. It is about 6 centimeters, so within normal limits. Normal is 6 to 12, so everything looks good there. No pain so far?
No.
Any questions?
No.
Good. I'll put this away. Now I'm going to assess for a gastric bubble. So what I'm going to do is go over his left side of his lung fields, and once I hear this tympanic sound, I'm going to have you take a deep breath and see if that changes, okay?
Yep.
All right, here's some resonance going down his lung fields. Good. So notice for his air bubble, and I'm going to be feeling for his splenic, splenic dullness. Okay, so I'm going to do the same thing, go down his lung fields, should be resonant. Once I get to the end of his axillary line going down his intercostal space, it's tympanic right here, so now you take a deep breath and see if that changes to dullness. It does not, so it does not indicate any splenomegaly, anything involving the spleen. No sound changes, so that's good. So gastric bubble was assessed, it was there. Splenic dullness was assessed, no issues there. All right, now I'm gonna move on to the soft palpation or light palpation on his stomach, okay? Use my hand. Any pain?
No.
Good. So upon light palpation, no masses so far, no tenderness in the muscle, anything like that. Assessing the right upper lower and left upper lower as well. Everything looks good there. Now I'm going to be moving on to the kind of more firm palpation of the stomach, okay? I'm going to dig a little deeper, so you just stop me if there's any pain, okay?
Yep.
Feeling for masses, bulges, assessing all the quadrants of the abdomen. Good. So no masses or bulges felt during any palpation, no muscle tenderness, anything like that. Feeling his umbilicus region too, around the umbilical ring. All right, now I'm going to assess for the liver border. Going to push in your stomach, okay?
Yep.
Trying to find his lower border using 2 hands. Sometimes you can feel the lower liver border with this technique. Okay, now I'm going to try another one, okay? I'm going to put my hand underneath your back, using a full hand pointed medially, trying to assess his liver. Okay, any pain?
Nope.
Just again looking for that lower liver border. It's kind of tucked away under his right side of his rib cage. Again, just looking for those liver borders. Now I'm going to use the third technique, which is the hook technique. We take a deep breath, hook my fingers under his rib cage and feel for that liver. All right, good. So liver borders were felt using the 3 techniques. And next I'm going to look at his gallbladder. So on the right side, by the costovertebral, the costal angle, big exhale for me. big inhale. Any pain?
Nope.
Good. So with this test, we're looking for Murphy sign or positive Murphy sign, which would be after you locate the gallbladder on the right side, when he inhales, that should be painful if he has any cholecystitis, any gallbladder issues. So it's a negative Murphy sign, which is a good sign. No pain in your gallbladder. Now I'm going to palpate your spleen. I'm going to reach around your left side of your ribcage and pick you up. Spleen is tucked away in the left ribcage, coming in at a 45-degree angle, trying to feel for that spleen. Any pain?
Nope.
Good. All right, you can relax. No positive signs for spleen. No indications of enlarged spleen, anything like that. No pain noticed. No enlargement so far in his abdominal inspection. No masses, anything like that. So we're looking good so far. Okay. Any questions?
No.
All right. So just finishing up the palpation here, just feel your aorta. Okay.
Yeah.
Good. No obvious pulsations, not bounding, anything like that. No masses felt, no deviations in his abdomen, which is looking good. No pain?
No.
Good. Awesome. Now, wrapping it up, I'm going to assess his kidneys. I'm going to place my left hand under his flank. My right hand is a little laterally of his right lower quadrant. Press down at the same time. Can you be a bit inhale, exhale? Any pain?
No.
Trying to feel for those kidneys. Good. Do the same thing on the other side. Under his flank. Now by his left lower quadrant, a little lateral. Deep breath. Good. Any pain?
Nope.
Good. Kidney assessment is good. No pain, no abnormalities felt, no masses, lesions, anything like that upon inspection. So lastly, I'm going to have him sit up and face the wall and test for costovertebral angle tenderness of his kidneys. So coming down on his back, looking at his costovertebral angle on both sides. Tell me if there's any pain. No pain?
Nope.
No pain?
Nope.
Good. Awesome. So no kidney pain. Notice bilaterally, everything looks good there. So everything looks good in his abdominal assessment. No masses noted, like I've been stating. Active bowel sounds. Everything inspection looks good, symmetrical. So now I'm going to move on to his blood vessel assessment. Maybe lay flat again. All right. Now I'm going to be testing for jugular venous distension, looking for pulsations. No JVD noted. Looking for pulsations. Looking for pulse waves. Venous waves should not be palpable. Arterial waves are. We're looking for the A and the V wave. Everything looks good. I'm going to have you face the wall and turn your head. Still looking for that jugular venous distension. It's negative, no signs of JVD, no signs of congestive heart failure. No bounding pulses. Okay, everything looks good. Now I'm going to kind of have you do that crunch again where you're sitting at probably like a 45-degree angle, okay?
Yep.
Then, yeah, just sit up first, if you would. Okay, same thing. Sorry, it's uncomfortable.
You're fine.
Again, no JVD, no distension. Opposite side. Same thing bilaterally. Alright, you can lay down again. Alright, now I'm going to listen to his carotids using the bell for any bruise. Hold your breath for me. Thank you. Good. So listening to his carotid arteries, there's no bruise noted. I'm just going to do a quick pulse check on the carotids, okay?
Yep.
One side at a time. Good. Alright, so the pulses are equal on both sides bilaterally. Controlled rate, controlled rhythm. No differences, 2+ on both sides, no issues there. Alright, now I'm gonna have you sit up, okay?
Yep.
Have you face the wall. Alright, now I'm gonna check for his, let me see if I can move this. You can see me. Alright, now I'm gonna check for his peripheral arteries and veins. Checking for sufficiency. For sufficiency, color, his nail beds. I'm gonna be looking for any varicosities, his skin texture, any muscle atrophy, anything like that. Take your right arm. Check your radial pulse. Using the clock. Check your ulnar pulse. Good. Brachial pulse. So assessing his peripheral pulses. All are 2+, easy to feel. I got heart rate about 70 beats per minute. I'm gonna do the same thing on the other side. Radial pulse. Good. Ulnar pulse. Brachial pulse. Good. So pulses are all 2+, regular, even, no abnormalities. Skin is in good texture, soft and smooth, evenly hair dispersed, warm in texture. Now I'll have you do the Shamrock test. So I'll have you take your fingers like this. We're going to test for clubbing. And you can move all of them with your index finger. Good. Good. We're assessing for clubbing. Negative. I'm going to check your nail beds. Pink. Checking for capillary refill. Good. 2. Other hand. 1, 2. 1, 2. Alright, so capillary refill is less than 2 seconds. Nail beds are pink. Cuticles are intact. No lesions, no cuts, scrapes, bruises, bumps, hematomas, anything like that. Even hair dispersal, so skin is in good condition. So no varicosities on his arms, nothing like that. So we're good. Now we're gonna move on to his legs. See if we can move the camera a little easier. Okay, leg assessment, feeling for temperature and color. Color is appropriate for ethnicity, Caucasian male. Good. Temperature is warm and dry, no issues. Popliteal pulse. Same thing on the other side. Alright, so popliteal pulse is 2+. Now posterior tibial. Dorsalis pedis. And the same thing on the other side. Dorsalis pedis. Posterior tibial. Good, so all pulses 2+. No edema noted, no pitting edema. Can you feel that in your leg?
Mm-hmm.
Feel that in your leg?
Yep.
Appropriate sensation, good hair dispersal. Like I said, color appropriate for ethnicity. No issues there. Smooth skin texture, evenly hair dispersed. No lesions, anything like that. Cuts, bruises, scrapes, bumps. Yeah. Do you have any questions for me for today's exam?
No.
So that'll wrap it up. Thank you.